Good morning, students. Already we completed the revision classes on haloalkane, halorine, alcohol, phenol, ether, aldehyde, ketone, carboxylic acid, amines, and chemical kinetics. Now the last revision class is what was the chemistry in everyday life and polymer. It's a very small chapter. Okay. And earlier in the syllabus also we have biomolecules, but in the new syllabus this biomolecule is lifted, so we need not to read about the biomolecules. Simply polymer, and also in chemistry everyday life we were chemistry in food, that also not required. Simply chemistry in medicines and soap and detergent. In the soap and detergent, we have also the cleansing action of soap and detergent, but this we will discuss in another chapter called surface chemistry. So on the cleansing action of soap and detergent, no question will be asked on this pretest examination. Okay, so simply we'll go for soap and detergents types. Okay, the uses and chemistry in medicine. Then after we'll go for polymers and its uses. First of all, we will have a quick revision of this chapters. Then we will go to then we will discuss some questions. Okay. So in the quick revision of the chemistry in everyday life, basically chemistry in medicine. So what we need to know? We need to remember. We need to remember the name of medicines used for specific diseases. Medicines are the chemical substances which are used to getting cure from diseases. Okay, and depending upon the type of disease, we have different kind of medicines. First of all, we can say we have analgesics, we have antibiotics, we have antimicrobials, we have antihistamines, we have antacids, we have antifertility drugs, and also we have tranquilizers. Okay, so we need to remember the type, what is the type of medicine and what is the uses and examples of some medicines. For example, analgesics are the drugs which are used to getting relief from pain. To reduce the body pain, we are using analgesic. And analgesic can be of two kinds: narcotic and non-narcotic. Narcotic analgesics are those which, when a patient is taking, that he or she is getting addicted, like heroin, codeine, okay, morphine, and these are the all these medicines are the origin of opium. Okay. And non-narcotics are the analgesics which are given to the patients suffering from body pain after the surgery or any kind of injury or accident. And these after taking these medicines, the patient is not getting addicted, like aspirin, paracetamol. Okay, many are there. Similarly, your antibiotic drugs are the chemical substances which are given to the patients who are suffering with fever. To reduce the body temperature to the normal level, we are giving the antibiotic medicines like your paracetamol. And paracetamol is a popular medicine. I think everybody knows it, and nowadays during this corona period, everybody knows about paracetamol. Okay, so paracetamol is used to reduce the body temperature to the normal level. It's an antibiotic. Okay, and this paracetamol also we can use as your analgesic. Paracetamol can be used to reduce the body pain and also to reduce the body temperature. So paracetamol can be used as an antibiotic as well as an analgesic. So there may be questions: which of the following can be used both as an analgesic and antibiotic? Suppose I have suppose your paracetamol, we have your rentadine, we have suppose your penicillin, chloramphenicol, streptomycin, different medicines are there. Suppose. So you see paracetamol and also your aspirin, both are analgesic as well as antibiotic. Remember also aspirin and paracetamol both are analgesic, okay, and also antibiotic. Paracetamol is also antibiotic. Okay, so this type of questions will be asked. Now, then after your antimicrobial. Antimicrobials are the medicines which are used to kill the germs, bacteria. And these can be three kinds: antibiotic, antiseptic, and disinfectant. Antibiotic are the medicines which are given to the animals, okay, as a oral medicine or also as a injection, IV or IM, okay, or to kill the bacteria, okay, and like your penicillin, like your streptomycin, okay, like your ampicillin, like your cefixime, okay. So different kind of antibiotic medicines are there which are given as oral pills or also can be used as injection, okay, to kill the bacteria and also to inhibit the growth of the bacteria. Okay, some kind of antibiotics are there which can be used for the specific purpose only. These are called what? Narrow spectrum antibiotic. And some kind of antibiotics are there which are used randomly. There have been different uses for different kind of bacteria. Different kind of bacteria, we can use one antibiotic. It is called broad spectrum antibiotic. But when we want to kill only a particular kind of bacteria, and for that we are using a particular kind of medicine, we are using what narrow spectrum antibiotics. Okay, so question may be asked, which of the following is a narrow spectrum antibiotic? So we have to remember different kind of narrow spectrum antibiotic and different kind of broad spectrum antibiotic examples. Okay, so from that we have to choose. For example, your penicillin is a narrow spectrum antibiotic. Okay, so we have different antibiotics. Remember the names. Then disinfectant. Disinfectants are the chemical substances which are used to kill the germs or bacteria completely, and they are applied on the non-living tissues. That is your for floor cleaning, okay, for washing of for cleaning of the toilets, okay, like your bleaching powder, like your chlorine, like your phenyl. So these are the disinfectants. And antiseptic are the chemical substances which are used to kill the bacteria or to inhibit the growth of bacteria, and they are applied on the living tissue. For example, dressing of the wounds or cuts, like betadine, tincture of iodine, okay, 0.2% of phenol, okay. Many kind of antiseptics are there that we have to remember. Okay, so give the name of an antiseptic. Question will be there: what is antiseptic, and give two examples of antiseptic. So you write the definition. Antiseptics are the chemical substances which are applied on the living tissue to kill the bacteria or to inhibit the growth of the bacteria. And these all are used externally. Antiseptics we are not taking orally or internally. These are the external uses. So similarly, your anti-fertility drugs are those which are used for prevention of the unwanted pregnancy in women. Okay. So for that purpose also we are taking different kind of pills. Morning after pill, like mifepristone. Now antacids are the medicines which are used to control the acidity. Okay, of the stomach. And there are many antacid medicines are there, kind of ranitidine, we have osmeprazole, we have raprazole, metaprazole, okay, hemotidine. So these medicines, so you have to remember, okay. So question may be there, what are antacids? Give two examples of antacids. So we have to write the names. So now your tranquilizers are the medicines which are used for the mental patients. Okay, so these are called neurological active drugs. Okay, so for the anti they can be used as antidepressant and for sleeping doses. Okay, like equanil. Okay, so many kind of medicines there we have to remember. Okay, this is all about your medicines. Okay, and also we have the antihistamine. Antihistamines are there which are used against the allergy, like cetirizine. Okay, cetirizine is a medicine which can be used for the used as anti-allergic. So the whole purpose is okay. Just we have to remember the different medicines against different disease. Okay, questions simply only will be your 1 mark questions, 1 mark or 2 mark. What are antibiotic? Give example of a narrow spectrum antibiotic or a broad spectrum antibiotic. Okay, so the questions like this. Okay, so now we have the polymers. We know polymers are the big giant molecules which are produced by the combination of a large number of monomers. Okay, and here in this chapter also we have 1 mark or 2 mark questions. Like write the monomer of 9 and 6. Write the monomer of 9 and 6s. What are additional polymers? What are condensation polymers? Okay, 1 mark questions. Or there is 3 mark questions like what are thermosetting and thermoplastic polymers. Right, about distance between thermosetting and thermoplastic. Okay, so these are the main questions on the polymers. Okay, so polymers are classified on different heads. Okay, the polymer can be natural polymer, can be synthetic polymer, depending upon their synthesis. If we are getting the polymers from the nature, or the natural polymer. If we are synthesizing in the laboratory, that is called synthetic polymer. Now, on the basis of molecular process, the polymers can be thermosetting, can be thermoplastic, can be fibers. Now, depending upon the type of synthesis, the polymers can be additional polymers or can be synthetic polymers, can be condensational polymers. So, in additional polymers, only the monomers are being added and we are getting the polymer. In the condensational polymer, the monomers are being added and one or more simple molecules like water, ammonia are being evolved. They are called condensational polymers. So we have to remember the name of the monomers and name of the polymers. Okay, and their uses. Okay, suppose 9 and 6. What are the monomers of 9 and 6? Okay, and what is the structure of 9 and 6? 9 and 6, your caprolactam is the monomer. Okay, and we get the 9 and 6. Similarly, and the important thing we have to remember here is the rubber, about the rubber. What is natural rubber? Synthetic rubber. Now, what is the monomer of natural rubber? Isoprene. Okay, and synthetic rubber we can have a Buna S, we can have Buna N, we can have nitrile rubber. And again, one thing we remember, the rubber are the raw rubbers. The raw rubbers are not in a position to use, and that needs your vulcanization. So we are adding some sulfur and we are heating so that the rubbers becomes stiff, it becomes somewhat hard, so that we can use it. So let us have a summarized discussion on this polymers. Okay, then after we will go for discussing some questions. Okay, so this is the summary of this classification of the polymers. Let's see, polymers are classified into 6 categories on the basis of source, structure, molecular forces, synthesis, degradability, and monomer units. Okay, On the basis of this source, already we have discussed natural and synthetic. Natural examples are the starch, protein, silk. Synthetic are polyethylene, polystyrene, PVC, polytetrafluoroethylene. Okay, and now based on the structure we have discussed already, it can be linear, branched or cross-linked. Okay, linear monomer units are joined together in a straight chain, branched, a straight chain with branch, cross-linked with three-dimensional structure. So linear example HDFE, high density polyethylene, okay, nylon and PVC. Branched LDP, low density polyethylene and starch, cross-linked by bakelite. Okay. Now on the basis of molecular process, the polymers are elastomer, fiber, thermoplastic and thermosetting. The elastomers are rubber, like natural rubber, Buna S, Buna N, okay, and then fibers, polyesters, nylon, thermoplastics like polyethylene and PVC, thermosetting like bakelite. Okay. Naturally, on basis of synthesis, additional polymer and conditional polymer. Additions like example what will be polythene, Buna S, Buna N, and what is like nylon, bakelite are the condensation polymer. Nylon 6 is there, nylon 6 there, nylon 610 there, nylon 26 there. Okay, different kind of nylons are there. Okay, now on the basis of degradability, it can be biodegradable like Dextron, like PHBB, and non-degradable like polyethylene and polyvinyl chloride. And on the basis of monomer units, it can be homo or copolymer. Homopolymers, that means it contains same kind of monomer units, polyethylene, PVC, PAR, etc. and contains different kind of monomer units like copolymers, like nylon 66 or nylon 610, nylon 600. Okay, so these are the different kind of polymers. In the next class, we will discuss about how to synthesize the polymers from this monomer units and what are the uses of specific kind of polymers. Okay, summary of the types of polymers and their uses. So here you see these are polymers, different polymers, their uses and what are their monomers. First of all, LDP, low density polyethylene. Then the monomer is your ethene and the polymer can be used for making toys and bottles. HDP, high density polyethylene. Okay, the uses are to prepare the containers and buckets. We are using HDP and the monomer is ethene. Similarly, PS, polystyrene. The monomer is your styrene and that we can use for making toys, forms and tiles. PAR, polyacrylonitrile, PAR or acrylon or lon. Okay, the uses are to manufacture carpets and blankets and that the monomer is acrylonitrile. Next is PTFE, polytetrafluoroethylene. The monomer is tetrafluoroethylene and the PTFE we are using for making gaskets, seals in the pressure cooker and also non-stick cookware pans. Okay. Now PVC, polyvinyl chloride. So here the monomer is vinyl chloride and we are using to prepare raincoats and tablecloths. Then terylene, the monomer is ethylene glycol and terephthalic acid, and here we are using for making magnetic recording tapes, terracotta, terry wool, etc. Okay, now nylon 6, the monomers are caprolactam. Okay, and we are using for preparing ropes and tire cords, automobile tire cords. Now nylon 66 here the monomers are hexamethylene diamine and adipic acid, and we are using for making climbing ropes and sheets. Okay, Similarly, the bakelite, here the monomers are the phenol and formaldehyde, and we are using bakelite to prepare to making for making electrical goods and fountain pens. Bunayaso, butadiene, styrene rubber. So here the monomers are the styrene and butadiene, and we are using for making automobile tires. And Buna N, the nitrile rubber. Here also the monomers are what acrylonitrile and butadiene, and we are using Buna N for making oil seals. Okay, so these are all about the polymer chapter. Okay, now next we will discuss about the chemistry in everyday life. So are the either sodium or potassium salt of higher fatty acid like palmitic acid, stearic acid, oleic acid, etc. So potassium salt of higher fatty acids are soft. They can be used as what of the bath salts or toilet salt. Whereas the sodium salt of higher fatty acids are hard soaps, and they are used for the purpose of washing of the clothes. Okay, and these soaps are manufactured under the principle of saponification reaction, and soaps are biodegradable. Clear? So these soaps which we are using for the process of washing of the clothes, we can use them with soft water. But when we have hard water, we cannot use the soaps for washing of the clothes. Unnecessarily there will be a huge consumption of this soap. So to meet this, next thing it is called detergents. So detergents are primarily used for washing purpose, but we have different kind of person. Okay, the detergents can be cationic, can be anionic, or can be also neutral or non-ionic detergents. And the detergents are bio-non-degradable. Okay, regarding this cleansing action of this soaps and detergents, that we will discuss in another chapter. Okay, that is surface chemistry. Okay, thank you. So these are the summary of different kind of drugs. Okay, you can see here analgesic drugs. Already we have discussed. These are the drugs which are used to reduce the pain. Okay, we can narcotic like morphine, codeine, heroin, and non-narcotic like aspirin, paracetamol, ibuprofen, diclofenac, sodium, anazine, novalgine. Similarly, antibiotic is to reduce the fever by temperature. Paracetamol, aspirin, novalgine, phenacetin. Antibiotics are used to kill the microorganisms like penicillin, ofloxacin, tetracycline, erythromycin, ampicillin, and amoxicillin. Okay, now antiseptic is to destroy the microorganism. Okay, in the living tissue, like Dettol, Savlon, Celon, Furacin, betadine, tincture of iodine, mercury chloride, 0.2% phenol, chloramine, and sulfamycin. Disinfectant is to kill the microorganisms and used in the non-living tissues, non-living places. So 1% phenol, CaOCl2, bleaching powder, SO2, H2O2, solution of creosote. Okay, and you will see one thing: 0.2% phenol is what antiseptic, but 1% phenol is what disinfectant. Okay, remember this: 1% phenol can be used as a disinfectant, but 0.2% phenol can be used as a antiseptic. Similarly, antifertility drugs, morning after pill, okay, mestanol, mifepristone, and norethindrone. Okay, now your antacid. The antacids are the medicines which are used to check the release of acids on the gastric juice. Okay, to control the hyperacidity. Okay, and so ranitidine, omeprazole, cimetidine, sodium bicarbonate, mixture of sodium, magnesium, and aluminum hydroxides are the different kind of antacids. Similarly, antihistamine is to is against the allergics. They are called also anti-allergic medicines, like cetirizine, okay, promethazine, terpenoline, bromophenamine. These are the different kind of anti-allergic medicines. Similarly, tranquilizer, okay, can be sedative, can be hypnotic, can be antidepressant. Okay, so compose, equanil, serotonin. See, there are some questions. These questions will be posted on the group. Okay. Now see some MCQ. Which of the following is an analgesic? The options are there: penicillin, paracetamol, streptomycin, xylocaine. So here you see penicillin is an antibiotic. Okay. Streptomycin also antibiotic, but paracetamol is an analgesic. Paracetamol can be used as an analgesic as well as an antibiotic. Normally, antibiotic drugs are used to relieve pain, produce loss of sensation, control malaria, and lower down the body temperature. So, antibiotics are the medicines which are used to lower down the body temperature. Soap is sodium or potassium salt of stearic acid, oleic acid, palmitic acid. I think all. So soaps are sodium or potassium salt of stearic acid, also palmitic acid, and also your oleic acid, because soaps are the sodium or potassium salt of higher fatty acids. Natural rubber is the polymer of isoprene, chloroprene, tetrafluoroethane, and 2-chloro-1,3-butadiene. So natural rubber is a polymer of what? Isoprene. Now, which type of medicine is used for treatment of pneumonia? So for pneumonia patients, we are using antibiotics. Okay. So given here antibiotic, antiseptic, analgesic, and antibiotic. You know antibiotics are used to reduce the temperature. Analgesic are used to reduce the pain. And antiseptic are used to kill the bacteria applied on the living tissue, and whereas antibiotics are used to kill the bacteria inside the body, so that we are using against pneumonia. Which of the following is a condensation polymer? We can have Teflon, neoprene, Buna S, and bakelite. Additional polymers are basically obtained from the unsaturated compounds. So Teflon is a polytetrafluoroethylene, and we are obtaining from tetrafluoroethylene. So it's an additional polymer. Your neoprene also additional polymer, and Buna S also butadiene styrene rubber additional polymer. But when you take your bakelite is a condensation polymer of phenol and formaldehyde. Now nylon 6 is the polymer of potash. So given here adipic acid and methylamine not, sebacic acid and hexamethyldiamine not. So adipic acid and hexamethyldiamine is the monomer of nylon 6. Which of the following is not a condensation polymer? Terylene, acrylon, bakelite, nylon 610. You see, terylene is a condensation polymer, also bakelite of phenol and formaldehyde, and also nylon 610. Here, acrylon is what not a condensation polymer, it's an additional polymer. Which of the following can be used as an antiseptic? Here you see, boric acid there, tincture of iodine there, perhydral there, and all of these. I think all can be used as part of the antiseptic. Okay, we have boric acid can be used as antiseptic, perhydral, tincture of iodine, all are used as antiseptic. The polymer obtained from ethylene glycol and terephthalic acid is called what? It is called your terylene. Okay, so terylene is the polymer of ethylene glycol and terephthalic acid. Next, a substance which can act both as analgesic and antibiotic is this: quinine, penicillin, insulin, aspirin. See, quinine is an anti-malaria medicine. Penicillin is an antibiotic, and insulin is a hormone. So, aspirin is the medicine which can be used as an antibiotic as well as analgesic. Okay. Similarly, also we have some very short questions like write two uses of bakelite. So, how the bakelite is used? That we have write. Bakelite can be used for what? For making up combs, okay, for making up phonographic records, and also for your electrical goods. Now, write the name of two antiseptics. Okay, antiseptics many we have discussed. Antiseptics we have Dettol, we have Savlon, we have Bithionol. Okay, many are there. Similarly, we have questions like caprolactam on polymerization process test. You know, caprolactam is a polymer of water. Caprolactam is a monomer of water, nylon 6. So, caprolactam on polymerization process water, nylon 6. Similarly, we have question mercurochrome is used as a test. Mercurochrome is also what? It's an antiseptic. Okay. And also we have questions like this. What is PVC? We know PVC, polyvinyl chloride. Polyvinyl chloride is a polymer of vinyl chloride, and this polyvinyl chloride is basically used for the sanitary purpose. All the sanitary household pipes are on the PVC. Now, what is terylene? Terylene is a polymer of what? It is your ethylene glycol and your terephthalic acid. Okay. Now, bakelite is a polymer of dash and dash. Bakelite is a polymer of what? Phenol and formaldehyde. Okay. Now, paracetamol is used as a dash medicine. Paracetamol is an antibiotic used to reduce the fever. Now, name the polymer used for making non-sticking frying pans. So, for making non-sticking frying pans, we are using Teflon, polytetrafluoroethylene. Okay. So, polytetrafluoroethylene is a polymer of what? Tetrafluoroethylene, also called Teflon, and by using this, these are used for the making of the non-stick cooking pans. Okay. Similarly, we have a question like this: what are elastomers? Give example. Okay. So, rubber is an elastomer. Similarly, what are the monomers of Buna S, Buna N, Deccan, neoprene? So, all the polymers are there. That we have to write this monomers. Like your Buna S, your butadiene, styrene, and styrene. Okay. Similarly, what do you mean by broad spectrum antibiotic? You see, so those antibiotics which can be used against different kind of bacteria. Okay, in a broadly they can be used called broad spectrum antibiotic. Those antibiotics which are used only for a specific disease to kill a specific bacteria, that is called narrow spectrum antibiotic. So either only gram-positive against a gram-positive bacteria or only against a gram-negative bacteria. That is called narrow spectrum antibiotic. But when we are using the antibiotic against both narrow spectrum and also broad spectrum, that is called and the antibiotic which we are using both for gram-positive bacteria and also for gram-negative bacteria, that is called broad spectrum antibiotic. Okay. And also, what is tincture of iodine? So that's composition we have to remember. Okay. What is the difference between antiseptic and disinfectant? You see, antiseptics are the chemical substances. The antiseptics are the antimicrobials which we are using on the living tissue for dressing up wounds and cuts. But disinfectants are used to kill the bacteria, and we are applying on the non-living tissues. Okay, surfaces. Finally, we have also the short questions. What are antihistamines? Give an example. Right, antihistamines are the chemical substances which we can use against the allergies. They are anti-allergics. And example, cetirizine, levocetirizine, terpentine, and many more are there. Give the principle of preparation of nylon 6,6. Okay, you just write the monomers of nylon 6,6, hexamethyl diamine and arabic acid, and you take these molecules, give the condensation reactions, and find the product nylon 6,6. What is the neoprene? Give its one use. Neoprene is what? Neoprene is synthetic rubber. Its monomer is chlorophyll. Okay, now you take the chlorophyll, and write n number of chlorophyll. You will get what? Neoprene. What is Teflon? Give one of its use. What is Teflon? Teflon is what? Teflon is the polymer of tetrafluoroethylene. Okay, so when tetrafluoroethylene undergo polymerization, we are getting polytetrafluoroethylene or Teflon, and this Teflon is used for preparing of frying pans, non-sticking cooking pans. Okay. So, and also we have some three mark questions there. In the 3 mark questions, there may be asked that what are thermosetting and what are thermosetting polymers and thermoplastics, and differentiate between them. So we can write thermoset. What are thermosetting? What are thermoplastics? Okay. And also there may be question. What are addition and condensation polymerizations? Give examples. So just write the definition. Addition polymers are those where the unsaturated molecules undergo polymerizations to give the polymer. Here, a large number of unsaturated molecules are combining to give the polymer. Whereas condensation polymers are those where one or more simple water molecule or ammonia are being released and 2 molecules are attached. Okay. And then examples of some additional polymer like polyethylene, PVC, Teflon, etc. And examples of some condensation polymers like nylon 6, nylon 6,6, bakelite, etc. Okay. So these are all about your revisions on the chemistry in everyday life and polymers. Okay. So you just remember the questions and answers. Okay. Thank you.